everyone, I am Ronielyn Lanaban, a student nurse at Davao Oriental State University. Right now, I will be discussing with you the 4 types of anomalies of the placenta. The delivery of the placenta happens at the 3rd stage of labor, which can result in some complications. That is why a continued observation of the pregnant mother is very crucial. The placenta is a maternal fetal organ that begins development at implantation of the blastocyst, and it is delivered at birth with the fetus. The fetus relies on the placenta for nutrition and many developmentally essential functions. As you can see in this illustration in the illustration above, this is an example of a placenta together with its parts. After childbirth, it is customary to inspect the placenta and umbilical cord for any abnormalities. A typical placenta weighs around 500 grams, measures 15 to 20 centimeters in diameter, and has a thickness of 15 to 30 centimeters, constituting approximately 1/6 of the fetal weight. In cases of diabetes, the placenta may exhibit unusual enlargement. Certain diseases such as syphilis, or also known as a sexually transmitted disease caused by a bacterium, or erythroblastosis or hemolytic anemia in the fetus caused by transplacental transmission of maternal antibodies to fetal red blood cells, can result in an exceptionally large placenta, weighing up to half of the fetal weight. Scarring, or the presence of a uterine septum, a wall-like structure dividing in the uterus, can cause the placenta to widen in diameter as it adjusts to find sufficient space for implantation. Now, let's move deeper and tackle the main point of this video, which is learning the 4 anomalies of the placenta, which are the placenta succenturiate, placenta circumvallate, Battledore placenta, and also the Velamentous cord insertion. Let's first start from the placenta succenturiate. A placenta succenturiate is a rare variation in a placental structure during pregnancy. Typically, the placenta is a single disc-shaped organ attached to the uterine wall, but with the placenta succenturiate, additional smaller lobes or accessory lobes are connected to the main placenta by blood vessels. This when the chorionic villi, which is responsible for the nutrient and waste exchange between the maternal and fetal blood, develops separately. As a result, the placenta appears divided into distinct sections. While the placenta succenturiate is generally considered benign, it poses certain risk. The additional lobes may not detach fully during delivery, potentially causing retained placental tissue, which could lead to postpartum hemorrhage. Additionally, there is an increased risk for the blood vessels between the lobes rupturing, which may result in excessive bleeding. Diagnosis is typically made through ultrasound imaging during routine prenatal care. Management involves close monitoring during pregnancy and careful attention during delivery to ensure a complete placental expulsion. Healthcare providers must be aware of this condition. Why? As it affects the birthing process and necessitate specific intervention to minimize potential complications. Overall, while placenta succenturiate is uncommon, understanding its implications is very essential or pivotal for ensuring a safe and healthy pregnancy and delivery. Let's proceed to the second of the 4 placental anomalies, which is the placenta circumvallate. So what is placenta circumvallate? A placenta circumvallate is another uncommon variation in placental structure that can affect pregnancies. In this condition, the amniotic membrane extends beyond the normal insertion point on the placenta, creating a circumferential fold or ridge around its edges. This results in a double-folded appearance of the fetal membranes, as you can see above. So this condition is typically identified through ultrasound during routine prenatal examinations. A placenta circumvallate is associated with an increased risk of adverse pregnancy outcomes. The abnormal structure can restrict blood flow to the developing fetus, leading to the complications such as intrauterine growth restriction or IUGR or preterm birth. There is a higher likelihood of the experiencing problems during labor and delivery with placenta circumvallate. This condition may be linked to a higher risk of placental abruption, where the placenta detaches from the uterine wall before the delivery, potentially causing bleeding and compromising fetal oxygen supply. Managing a pregnancy with placenta circumvallate involves close monitoring, including more frequent ultrasound exam. So the next one is the Battledore placenta. So what is this Battledore placenta? A Battledore placenta is also known as a marginal cord insertion. It is a condition in which the umbilical cord is inserted at or near the placental margin rather than in the center. The cord can be inserted as close to 2 cm the edge of the placenta. The incidence is 7% to 9% of singleton pregnancies and 24% to 33% in twin pregnancies. Complications associated with Battledore placenta are preterm labor, fetal distress, and also intrauterine growth restriction. And lastly is the Velamentous cord insertion. If you are wondering what is Velamentous cord insertion, well, it is a pregnancy complications that happens with the umbilical cord from a fetus doesn't insert into the placenta correctly. As we can see in a normal pregnancy, the umbilical cord connects the baby into the placenta, facilitating the exchange of nutrients, oxygen, and waste products. However, in cases of Velamentous insertion, the umbilical cord inserts into the fetal membrane or also known as chorion rather than attaching directly into the placenta. Typically, the umbilical cord travels from a fetus belly button to inside the placenta, where there's easy access to the nutrients a mother and the fetus sharing. A gel-like substance called Wartho's jelly is the one who protects the blood vessels inside the umbilical cord so that they don't twist, squeeze, or break. With Velamentous cord insertion, the umbilical cord attaches to membranes outside of the placenta instead. This means that the blood vessels from the umbilical cord have to travel much farther to get nutrients from the placenta, and they have to travel without the protection of what we call the Wartho's jelly. Without access to the placenta nutrients, a fetus may develop more slowly. Without the cushioning from Wartho's jelly, the exposed blood vessels from the umbilical cord are more likely to burst and bleed. Velamentous cord insertions are rare. Only about 1% of a single birth pregnancies and 6% of multiple births involve Velamentous cord insertion. The rate increases to about 15% for twins who share the same placenta. Certain factors may increase the likelihood of Velamentous insertion, including multiple pregnancies, which includes the twins and also the triplets, a low-lying placenta, or pregnancies conceived through in vitro fertilization. So what are the Velamentous cord insertions complications? So let me tell you this. About 6% of pregnancies with Velamentous cord insertion also have a condition called vasa previa. So what is vasa previa? With vasa previa, the umbilical cord attaches to the membranes that are close to your cervix. During labor, the exposed blood vessels run an especially high risk of bursting when the fetus starts putting pressure on your cervix. Both the mother and the fetus run the risk of heavy bleeding. About half of these pregnancies end with stillbirth. Getting diagnosed early can prevent this from happening. If your healthcare provider sees exposed blood vessels from the umbilical cord near your cervix, they'll likely suggest a C-section. The outcomes associated with vasa previa improve greatly with a C-section, or also known as cesarean section. The survival rate of the fetus goes up to 97% to 99%. Basically, monitoring and management is pivotal. Pregnancies with Velamentous cord insertion often require close monitoring. Regular ultrasound examinations help assess fetal growth, amniotic fluid levels, and the integrity of the umbilical cord vessels. If complications arise, healthcare providers may consider interventions such as early delivery or elective cesarean section to minimize risk. This coincides with the patient education and counseling. Expectant mothers diagnosed with Velamentous insertion should receive true counseling from healthcare providers, understanding the potential risk, the need for careful monitoring, and potential delivery consideration is crucial for informed decision making. In conclusion of this one, Anomalies of the placenta encompasses a diverse range of conditions that can impact the course and outcome of pregnancy. Placental anomalies often require vigilant prenatal monitoring, early detection through imaging studies such as ultrasound, and also a multidisciplinary approach to management. Understanding the specific characteristics and implications of each anomaly is essential and crucial for providing tailored care to expectant mothers and optimizing outcomes for both the maternal and fetal components of the pregnancy. Timely identification of placental anomalies allows healthcare providers to implement appropriate interventions ranging from close monitoring and lifestyle modification to more invasive measures such as cesarean section when necessary. Additionally, patient education and counseling are integral components of managing placental anomalies, empowering expectant mothers with knowledge to actively participate in their care and make informed decisions. As research in obstetrics and maternal fetal medicine advances, ongoing efforts to refine diagnostic methods, improve productive capabilities, and enhance therapeutic options will further contribute to the comprehensive care of pregnancies affected by placental anomalies. Ultimately, a collaborative and informed approach between healthcare providers and also pregnant individuals is paramount in navigating the complexities associated with placental anomalies and striving for the best possible outcomes for both maternal and fetal health. Thank you for watching. I hope you learned something in this video. If you have any questions or comments, please don't hesitate to drop it in the comment section. Bye!